Welcome, everybody. It's our second webinar. I am Craig with Dental Buyer Advocates. I'm joined by Dr. Sapna Amin. Sapna, how are you?
Good, how are you?
Not bad, not bad. I should really add you to this slide because your CV is far more impressive than mine. But just to introduce myself to folks, to give people an idea of who we are, I would generally be the first point of contact when somebody gets in touch with Dental Buyer Advocates. I'm here to support folks before they've ever even signed up with us. How do I find a practice? What does a good practice look like? How do I prepare myself for purchase? That's what my role looks like in the company. Sapna, you would be one of the next points of contact. You're one of the people who's helping to actually perform that initial due diligence phase, right?
That's correct, yeah. So we help the doctors when they sign up as a client. I'm called a transition consultant for the company. So we're going to help dive a little bit deeper than what Craig does. And I'm a dentist myself and own two dental practices. So I kind of help and walk the client through all the steps that they need to know prior to maybe doing a letter of intent.
Yeah, well, there you go. I also need to update my picture. I had cooler hair back then. All right, so we're going to, first of all, I want to let everybody know if you are watching this live, there is a chat box. You can put your questions in the chat box. That is available for you. So at the end of this, we'll be available to answer questions, hopefully pertaining to this topic that we'll get to in just a moment. But honestly, if you have other questions, go ahead and throw them in there. If it doesn't make sense for us to answer them here during this webinar, then we'll save them and make sure that we answer them. In fact, I think our next webinar is going to be a kind of a formalized Q&A session, just a general ask us anything, Reddit style AMA. So go ahead and throw those comments in there. But let's get started on the topic today, which is clinical overlap, which is kind of a fancy term for how well do you match up with the selling doctor. So Sapna, maybe in 30 to 60 seconds, how do you define clinical overlap? How do you think about it?
So what we're assessing is from their production reports that the seller has in the practice. Does 80-ish% of your own skill set as a buyer overlap with the seller's skill set?
Okay. So why 80%? Yeah, like what does that number mean? Why do you say that?
Typically, because banks want to see that you can personally do about 80% clinical overlap compared to the seller, because that's
Hmm.
one of their requirements, both in the amount of production that you do currently at your current job and also the skill, because we want to make sure that when you take over this practice, it's a small business, you're now a small business owner, that you have to make sure you can keep up with the production and that you're not stressed out the whole time as a buyer trying to keep up with keeping the revenue up and trending upwards.
Right, right. Okay, so when you're thinking about clinical overlap, you're not expected to do 100%. You're not stepping into the shoes of the seller and going at 100% of what they were doing and how much they were doing. So, yeah, I like to explain it as there's quantitative and qualitative clinical overlap. Are you doing, take that 80% number, and that's a little bit of a squishy number, right? But are you able to do the dollar amount that they were doing, right? Can you keep the cash flow up at that practice? And a lot of that is going to be fed by the qualitative side of it. Are you able to do the procedures that they were doing? So if
Mm-hmm.
somebody, if you're stepping into a practice where 50% of their revenue is coming from ortho and
Yes,
you don't do much ortho, you're in trouble, right? So
correct.
that's kind of what we're talking about. So
And typically, what we see the procedure to really keep an eye on is implants. If you don't place implants and they do, 50 cases a year, that's going to be a big struggle and a huge revenue loss when you take over.
yeah, exactly. And we're going to get into all that. So this is just an overview of what we're talking about here with this concept. So clinical overlap. Let's start with our 5 reasons, and this will make up the bulk of the content. So as we're going, make sure that you ask whatever questions you have. But the first and most important, right? Why are we here as dentists? And by we, I mean all of you, because I'm not disciplined enough to do all that school that you did, Sapna. Um, but why do we do this? It's to take care of patients. And hey, it's nice to be well compensated for that, and it's nice to have a great career and all the security that comes with it. But ultimately, it is about taking care of the patients, right? And so that smooth patient transition is what we're after. So if you step into a practice where there isn't great overlap, people are going to notice, right? In fact, I can remember, maybe you can back me up on this, Sapna, or correct me, but you know, when I was just a patient and I'd never worked with dentists before, and I was in my late teens, early 20s, and I was just kind of learning how to be an adult. And my mom talked to me about like how to find a great dentist. And she was talking about, she didn't have the words for it, but clinical philosophy. Is this somebody who's going to be really aggressive with their treatments or really conservative with their treatments? And she had her advice on what to look for and all of that. And so with all that in mind, I started going to a few different dentists, and I found one that I liked. And then if that dentist had sold the practice and somebody else came in with a totally different philosophy, I, as a patient, would have been really thrown off by that.
Mhm.
And then maybe I'd go start shopping around for a new dentist, right? Is that
And
about right?
yeah, so patients, anytime there's a changeover, you could be a dentist for 20 something years and you're buying a new practice. The patients already don't know you and they don't trust you because they don't know you. So now you go in and you tell, Susie that you can't do her endo
Right.
when she's already had two root canals at this practice with the current seller. Oh gosh, she's going to go tell her friends. And so now you're starting to have, an obstacle or a challenge at the goodwill that you just bought with this practice.
Yeah, exactly. So, yeah, anything else that we would want to say with regards to this
Also,
concept?
we know there's complications, specifically with more like implant procedures or removable devices that dentists do, something called like an overdenture, that sort of stuff. When you don't have that experience and problems will come in the practice, there's always going to be some remakes that need to happen or whatnot.
Mm.
When you don't have the experience, again, the patient loses trust. They feel like you don't know what you're doing, and it can lead to just a negative reputation right off from the bat. So I think that's also important to look at is that when you have that skill set, like a seller does, for 80% of the time, there's those rare one-off occasions that a seller might do, like a one veneer case. But if a
Mm.
seller's doing multiple cosmetic cases all the time and you've never prepped a veneer or you've prepped two, that's
10
going to
years
be
ago.
yeah, that's going to be a big issue.
Right. Okay, perfect. I love it. Uh, you know, when you're stepping into a dental practice as the new owner, patient retention is a huge topic, and it's a big, big fear that people talk about all the time. And I often will tell people like it can be an overblown fear. It's usually not going to be as big a deal as what you're thinking. That doesn't mean it's not important, and it is something to think about. But as I'm giving that advice, I'm assuming that you have good clinical overlap so that
Right.
this first point, you don't run afoul of this first point, right?
Hmm.
So patient retention, yes, it is something that you should think about. But if you step into the right practice, then you're golden. You're going to be looking good there. So,
Yep.
all right, let's move on to the next one, which is the staff. All right, if the patients, your practice doesn't exist without patients, right? That's what's providing the cash flow. Next up on the most important list is your staff. Fair?
Correct.
You were
Yep.
you were a practice owner for how long?
From 2010 to 2024, so
Okay.
like 14 years.
Yeah. So, yeah, how vital was a rhetorical question kind of, but how vital was your staff, right?
Oh yeah, huge. You can't do dentistry without it or without them.
There you go.
And
So,
you're about to be, again, you have to gain trust with this new staff. They don't know you, you don't know them. And they are used to a specific routine. People do not like change in general, and now you are the variable to that
mhm.
change. And so when you can't do the endo that was set up like on your schedule for 2 days from the day that you closed and you walk into the practice, now staff has to go and like figure out who's going to do this root canal or this
Yeah.
cosmetic case, go, calm down the fears of the patient as well as the staff going, oh gosh, what's happening here?
Right. It's, they say you can't teach what you don't already know yourself, right? You can't transmit confidence in your boss. If you're a hygienist or what have you, you can't transmit confidence if you don't have it. And so, yeah, as the owner, you'd better be gaining the confidence of that staff. So,
Right.
this is so similar to the other point that I don't know that there's a ton more to say. Do you have any other thoughts on how to deal
Yeah.
with the staff with this?
One more thing, remember, part of buying a practice is also the staff goodwill.
Mm,
So when you are a new owner to a practice, your staff, if they trust and believe in the competency that you have, are going to go say to their mom or dad, who is a patient at the practice too, or neighbor or whatnot, oh yeah, Dr. So and so is great. You're going to be in great hands. It just really elevates
mm.
that transition much smoother and more successfully.
And it's the kind of concept that anybody who has ever been an employee is going to understand intuitively. I'll give you a story from my business banking days, where I was working in a bank branch, and it was the busiest branch in Washington State at this large bank that I worked for. And so, anyway, it was a very successful branch. It ran really smoothly. And one day, the branch manager quit. He went to go manage I think it was a furniture production plant in the Philippines. They're like, how about that for a job transition? But anyway, so he leaves. They bring somebody else in to manage the branch. And she comes in, and I not even just day one, but minute one, she comes in and says, "I'm so excited to be here. You are going to love me so much. And here's a list of all the stuff I'm going to change." And a lot of it was like really important processes that had been put in place for months and years. And she's like, "Oh no, we can do this better." And we're like, "Hey, we're already high performers. We're already doing great, and you're coming in here telling us that everything needs to change. Well, screw
Yeah,
you, lady." Like, that was
yeah,
the
yeah,
staff had that mindset from the
right,
beginning. She ended up doing okay as the manager, but the
right.
first month or so was dicey
Sure.
because
And staff,
her philosophy didn't overlap with the previous manager. So,
some practices have a bonus system,
mm,
and it's always usually related to revenue procedures. And if they're not able to capitalize on that or see that you're not competent with that skill, then they're also thinking in the back of their head, do I start go looking for another practice? And
exactly.
that's what you don't want when
Yeah.
you take over. Yeah.
Exactly right. So before we move on to the next one, I'll just remind everybody who has just joined it should be on the right side of your browser window. There's a little chat box. As we're talking, if any questions pop in your mind, related to this or other things, you're welcome to put that in the chat, and we'll do a little Q&A at the end here. So let's move on to number 3, sustained revenue and treatment planning. All right, so ooh, should we talk about banks with this one, Sapna?
I think so.
I think
Yes.
I think this is where we talk about banks. So basically, this is we've we've danced around this a little bit with the other two, but basically, you're buying a revenue stream, you're buying a patient base and a staff, but that revenue stream is the number one most important thing to the health of the practice. And if you come in and you don't have that great overlap financially, you're screwed, right?
Yep, yep. And from a bank's perspective, you're now a high risk borrower, right? So why would they want, if you typically only produce right now 40, 50,000 a month at your current associate crappy position, and you go into buying a practice that's doing 1.2 million in revenue, not production, but collections. So that means even the production's higher, then it's important that you understand not only do you have to sustain that for what the doctor's doing, but also you have to show that you can increase it 3 to 5%. Because at the end of the day, the bank wants to get paid with their loan that they're about to borrow or lend to you. And so that's why it's very important to dig deeper when you're looking at practices and seeing where is their revenue coming from when you're looking at broker reports or prospectus and that sort of thing.
Yeah. Oh, there you said it beautifully. So I'll kind of mention a related thing that I will often tell new buyers or people who are just getting started on their journey, um, banking is a common question, and and it's said with a little bit of fear. Well, I need to get a loan. That's a huge loan. How do I get the loan? I'm scared, right? The banks make people scared, and that's fair, right? If you're borrowing $1 million, okay, like a little bit of nerves is totally fine and fair. But I will often tell people, yes, the banks are a gatekeeper. And yeah, they could say no. You could bring them a practice, you've got a signed LOI, the letter of intent, you're barreling toward closing, and the bank comes in and says, nope, not a chance. Nobody will lend to you. And you're crushed. And
Yeah.
oh my gosh, my dream of ownership, what am I going to do? And what I'll tell people with this topic is they just saved your life,
Hmm.
at least professionally and financially. Because if the bank sees that that revenue is going to drop precipitously if you step into the ownership role, uh, they're not going to lend to you. So, what the bank, Sapna, you can maybe talk to this a little bit. What is the bank going to be looking at? Procedure reports. They're looking at you and the seller, right? So that's part of their due diligence,
Yeah.
right?
So we work with, the top bankers in the country that do dental lending. Bank of America, Provide Bank, US Bank, Huntington. Realize that every bank has different requirements. So that is one thing to keep in mind. But also there's a reason. The ones that have the stricter requirements typically have the best rates. And at the end of the day, when you're buying an 800 to over $1 million practice and taking on a loan, of course you want the lowest rate. But secondly, dentistry is hard. I know I've been chair side. The last thing you want is to look at your schedule and groan and moan in the morning or feel that really icky gut feeling that you're like, crap, I've got a molar endo, I've got a veneer broken on so and so's tooth, like all the procedures that you don't know how to do. The all on four is broken. And if you don't know how to manage those situations when the seller is doing this routinely. Now,
Mm.
those one offs are going to happen. So that's where you use your specialist. But when it's routinely, the bank also is looking at that. So they're looking at your current production reports. And a lot of times, what I encourage my buyers when they're new clients, I ask them, well, how much are you collecting on a month? They don't even know that answer.
Mm.
They know how much they're producing or they know their yearly paycheck, but it's really important, especially if you're working at multiple practices. Maybe you're 2 days at one and 3 days at another. You need to keep track of your collection reports. And if you don't know how to get that, ask the office manager or the front office person there at the practice, and you should have every right to it because the banks are typically going to look at how much did you actually get from that, revenue from that procedure because there's write-offs and insurance things and that sort of thing. And one or advice is if you're not at a very high productive associate position, but you know you're capable of doing more and you're going to be buying a practice in 6 months to a year, go temp, go find a part time position,
Oh,
go
really?
do something to show to the bank I'm a good borrower, I'm a good producer, I know how to do these procedures because at the end of the day, they are going to put a microscope to that. And it's important because they're about to lend you a ton of money at a really good rate. And that's in the best interest for you.
Yeah. So how much history do you need to have to be able to show the bank? If you're out temping for 3 to 6 months, is that going to be enough, or are you going to need a longer continuous history?
I mean, obviously, the more the better,
Okay.
but I also know that sometimes there's like non-compete issues that you have with your current contract, or like nobody wants to be working 6 days a week. I understand that. It's hard on our bodies. We want to have a life too. We just went through dental school. But the importance is just as soon as you notice if your practice that you're currently at is not to the potential, like you're getting whole, it's like Swiss cheese, or you're seeing declining production revenue, get into something quick as soon as you can. Most banks, again, that's where we introduce you to bankers really early on in the process to have these conversations. I feel like most of them want about 6 to 9 months to see some data. But I also know that's not feasible, and I've had great success with buyers just doing a few Saturdays just to show another 5 to 10K on their production history.
Yeah. Okay, good. Let's move on then. So, unless you have anything else you want to say on this subject, I think we can move on to number four, which is referring providers. So, this is going to be an adjustable expectation based on what kind of office you work in and what kind of work you want to do. So I talked to a lot of dentists who love that. Like, what do we call them? The CE hunters, the ones who are just out. They're addicted to CE. They want to do every procedure out there.
See, junkie or
Yeah, the
something.
junkies. Yeah, there you go. Yeah, that's right. Got any
They're
more of that
the,
CE?
they're the gunners in our dental class, like when we're going through school.
Yeah, yeah, there you go.
Oh,
So there are those out there, but not everybody wants to do every procedure. So if you're
right.
referring out, if you're stepping into an office that refers out quite a bit of work, or brings in a lot of work from people who are referring to you, either way, either direction, this is going to be a concern for you, right?
Yeah, certainly. So we've got a couple of sellers that we're looking at practices, and they do a lot of TMJ sleep dentistry because the other GPs refer that to their practice. Now,
Hmm.
you can imagine if it's only like 5%, cool, not probably a big deal. But, some of these sellers are doing 10, 15, 20% of their practice. And they hand the patient back to that GP practice, but they do that type of specialty work, especially rural areas, things like that, where there's not a lot of other medical providers. So yes, again, that's a big change for the community that is relying on that doctor. And so it's a conversation to have upfront, basically, to decide how that's going to go from there.
Yeah, there you go. If you're not able to do what the seller is doing, again, not entirely, but for the most part,
Right.
then you're going to have some tough conversations ahead of you and maybe some real clinical and financial difficulties. So,
Right. And that's
uh,
also where you may need to, in the discussion of buying, do you keep a seller on for a year or 2 years? Because sometimes they're mid case. Like, some of these cases don't just wrap up in 2 appointments. It can be months, a year, especially full mouth rehabs, that sort of thing.
mm,
And that's where dental buyer advocates and my team comes in with the analyst is we're going to figure that out for you. Does it financially make sense to take on this deal if you don't match with the seller's production, but you feel you can learn it in a year with some good mentorship, but at the end of the day are still going to only take home like 50,000 from this practice,
yeah.
then it might not be a good opportunity.
That's a good spot to, if folks watching will forgive me plugging dental buyer advocates a little bit in the middle of this, but it's one of the valuable things that we do, or others like us. Okay, there are other folks out there who do this, but if you go to your run-of-the-mill CPA and just say, hey, I need you to value this practice and help me out with my financial due diligence, and they run some numbers and go, yeah, it looks okay. All right, well, you've done some number crunching, and that's fine. But the valuable part about having a buyer's rep like us in there is we're not just looking at the numbers. We have folks like you, Supna, and other dental professionals on staff who are able to contextualize that stuff and help you spot this type of like a clinical overlap issue, and you can identify the severity of the gap between the buyer and the seller, and how big of a problem that's going to be in the immediate future and the far future.
Yeah.
Is that
Yeah.
fair?
Yep, yep.
Yeah.
So I know there was one of the questions that I think kind of ties into this was they're asking if the overhead is a concern I have, how common is it for the seller to stay on? And is that
Yeah.
negotiated in the price? What does it look like financially? That's what we do. That's what we do in a full report is we help figure that out for you. That's what you're paying for us to do is every practice is different. Every starting overhead is different at a practice depending on the revenue and just what other expenses are involved. And at the end of the day, I would say maybe 30% of our deals where the seller stays on longer than a year. Now, there's always sometimes a short transition period for goodwill, which we can talk about that on another webinar because
Mm.
it's not always the right way to do it.
Yep.
But, some buyers feel like they need to keep the seller on. It just depends on personalities as well. But financially is what we're going to help you look at. Does it make sense? But also from a banking standpoint, do you need the seller to stay on? because then the bank feels a little bit better knowing if a seller's staying on 2, 3 years to do these types of high level cases, especially complex, third molar extractions, and you never do that, or IV sedation. But you have that chance in the 3 years to learn it from CE and mentoring, getting mentorship, then they're going to like that better. But it all comes down to cash flow. Does it make sense for you?
Yeah. And gosh, this is a theme that I come back to a lot, no matter what the topic is in these webinars or the podcasts and blogs and all that. But it sounds so mercenary to say like cash flow is king. Like, hey, come on, this is medicine. These are patients, and it's about more than just the money. And like that's yeah, but without the income, without that cash flow, your practice is going to close. And then where are your patients? Where's your staff? Where are you?
Right.
So when I love when I hear that it's all about cash flow, because frankly it is,
Yeah.
even if that sounds mercenary on the surface, right?
Right.
Okay, last one, Sapna. Avoiding costly practice repositioning. Now, if everybody has done their job up to the point of the purchase, right? Your CPA, your attorney, the bank, everybody's done their job. You have yourself as the doctor. Then this should not be a huge issue. But occasionally something does slip through, or maybe somebody wants to make changes, big changes to the clinical philosophy of the practice and the procedure or the production that they're doing. So this is something to consider. If you step into a practice or you remake a practice away from what it was into something new, it comes with a lot of risks. And this is what I think a lot of buyers assume that they're going to do or that they want to do. They they say, "Hey, well, yeah, sure, this practice only collects, 600K or whatever. Oh, yeah, it's a smaller one, or yeah, they have a lot of they do a lot of molar endo, and I don't really want to do that. I'll just make up the difference with this other stuff over on the other side." And it's like, "Yeah, maybe,
Right.
but now you're repositioning the practice, right?"
Yeah, or just keeping it steady, really, and then there's no growth, right? So
Hmm.
if you're doing 20% of maybe clear aligner therapy, like Invisalign or something like that, Sheer Smile, and you don't do surgical extractions because I'm not doing those, I'm not touching those. um, you have to make sure, does your team even have the training? Do they know how to present a $5,000, $7,000 ortho case? Whereas when it's surgical extractions, patients in pain, people understand wisdom teeth extractions a little bit more. They don't always understand how to present a treatment plan to something else elective like that. Secondly, do you have systems in place? Like, how do your ortho appointments work? Is your assistant trained? Are you going to be in every appointment, or are you going to try to have another chair just for that? And do you need technology, a scanner or whatnot? Whereas with the third molar extraction, yeah, you could argue you need a CBCT, or you could just get a pano, which most practices have by now. So you really have to be strategic and figure out what you're going to have to invest time and money for technology and systems and protocol and trainings to help replace that. And at the end of the day, did you net out better, or did you just keep things the same? Status quo.
Right.
Yeah.
Okay. There you go. I don't know what else to say on the subject. That's very succinct.
The one
Uh,
thing just one tip when you're asking brokers for information, we're always
mhm.
quick to go to tax returns and collection reports, but don't forget to get a production by procedure report.
Mm.
So that tells you by provider, so usually it lists the doctor and the hygienist and all that, what procedures are getting billed under that provider so that you can see what looks familiar to you and what looks unfamiliar to you. And it's also okay, you won't learn a lot about, one of the questions there is, how do you know your treatment philosophies are going to clash or not? Again, some of that can come in conversation, but a lot of it we're not going to know until we look at that procedure list and we see and we pull out the top 10 codes. If we see a doctor who is doing a ton of the code 2740, which is crowns, and it just looks very off. We kind of have metrics of how things should look in a GP practice for one solo doctor. If they're doing, so many units in a month, that tells me that they're probably a very aggressive treatment planner, and that should tell the buyer that too. So you've got to decide now, you're playing with your ethics and your morals.
Hmm.
Is this something that you're going to be okay going into practice? And you'll know when we do something called a clinical chart audit and we walk you through that. But sometimes you don't know up front, and that's what you have us for, and that's why we have dentists on our staff at DBA too to help with that.
It's a note to all the sellers and brokers out there. Hey, Sapna, how nice is it when you get that procedure report with all the codes? How nice is it when they have rank ordered it by percentage
Oh,
and you
yes.
don't have to hunt through the entire thing, right?
Dream come true.
It's the best. Because as a buyer, it's, think of it from the seller's perspective. You're immediately weeding out buyers that aren't going to work for you, or that aren't going to work out. Uh,
Offices that won't, yes,
yeah.
correct.
And
Yep.
so, as from the buyer's perspective, you're weeding out the wrong offices, and from the seller's perspective, you're weeding out the wrong buyers. So,
Hmm.
when you do those production reports, just click on that little thing that says, percentage or whatever, and rank order it so you can see
Yes.
right away. It's really nice.
And I also talked to my buyers about unfortunately, there's a hygiene shortage. We're
Mm.
just in a crisis in the dental world. So there are some practices where there's no hygienist. And so the doctors are doing the cleanings and all of that. If you're not going to be okay with that, stepping in right away, because it's expensive to put a hygienist on staff when
Mhm.
we again do a cash flow analysis on historical data, which shows they never paid a hygienist. And if you're not okay doing scaling and replanings and cleanings for half of your week, so every day there's going to be those types of procedures. That's also something to consider. You
Yeah.
really need to keep that on, especially pedo cases. I know sometimes what gets overlooked is the practice doing a lot of pediatric cleanings too, not necessarily by the doctor, but just in general. If you don't like seeing kids, make sure you're looking at that type of also small little procedures. Even though it's
Mhm.
in hygiene, that means they see a lot of kids, and so you need to be okay with the squirmy like heads and taking x-rays and elevating your voice when you're talking to them and having the whole open your mouth and that whole thing.
The yeah, the fun stuff for some folks.
Yeah, and I loved it, but my associate hated it.
Yeah,
So,
there you go. There you go. All right. Well, let's start the process of wrapping this up. I mentioned the Q&A. We've got a few things to go over. You mentioned a few of them already, but we'll run through them again. But anybody else who is watching live, just go to the right side of your browser window. There's a chat box there. Any questions that you have about clinical overlap, the stuff that we've been talking about, or other things as well, you can throw anything you'd like in the chat, and we'll address that. In the meantime, I have this screen up. You'll be able to come back and find this screen, but when we post this on YouTube or wherever it's going to go. But these QR codes are going to be really vital. This is just kind of a generic page. This doesn't necessarily have to do with overlap, although obviously it's overlapping subjects. But if you'd like any resources that dental buyer advocates can provide to you, then check out those QR codes. You can go to the website and get a discounted book. So it's $20 on Amazon. You can search it there. If you go to our website, we'll send it to you for 10. Basically, it's just paying for shipping. So go check that out. If you're at a point where you are in the search phase, or you are thinking hard about a specific practice coming up pretty soon that you may want to purchase, it's never too early to reach out to the right bankers. It's not even just the right bank necessarily, although that is important too, but the banker themselves, they're at least as important as which bank you call. And so we will hook you up with the right bankers from whichever institution makes most sense for you. And we're happy to do that for you wherever you're at in the process. So you can get the banker referrals there. Find a Practice refers to a PDF. It's actually a really good one. If I can toot our own little horn here for a second, the Finding a Practice PDF is awesome. It's going to walk you through what the 80/20 rule is. I'll leave that for anybody who doesn't know. You can go check it out. how to grow your network with other dentists, how to work with brokers. You want to send out a mailer, but you're like, I don't know what to put in a mailer. Well, we've got like 5 different examples of what people have done and been successful with. So that PDF is awesome. Make sure that you check that out if you haven't yet. Otherwise, all right, let's get to some Q&A stuff, Sapna. This is, let's see, the first one to come in. And like I said, you kind of addressed this a little bit already. Any tips on how to tell if our treatment philosophies are going to clash? So let me take a stab at this based on what you said, which was basically look at that production report, the procedures by code, and that's going to give you a really, really good overview of their. Uh, is it going to tell you about their clinical philosophy or just their practices?
Yeah, it's more of a quantitative,
Yeah.
again, you're just kind of taking an overview of, okay, man, they're doing still like a bunch of, four surface fillings. Then they're one of those doctors who most of the time aren't going to lean towards that crown. So maybe uber conservative,
Mm,
right? If you only see 5 crowns prepped in a month, then oh crap, like that's great because you can maximize probably really well in that practice. Because we know we probably prep a few crowns a day, you know?
right.
So if we're only seeing 5 in a month, that doctor's slowing it down. But a lot of times I know it's hard because our buyers don't even get to meet the seller. They're talking to a broker.
Right.
So you can ask the broker some questions like, is he mainly bread and butter dentist, or what does he spend most of his day, 80% restorative, crown and bridge, or is there any other elective procedures or skills that he likes to do? And then ask for the report, and from there you can kind of see other procedures. What throws us for a loop is the generic code, the D999
Mm.
something. That's just a generic code. We don't know. But if you're seeing like $80,000 billed out into it in a year, you want to find that out from the broker or the seller.
You
Like,
got some
what?
questions.
Yeah.
Yeah, it's how common is it that a buyer would get to an LOI or even close to an LOI without meeting the seller, just talking to the broker?
Oh, very common.
And,
Yeah, like
and
one, I mean, I would say 3 out of 5 deals, like every time.
yeah,
Yeah.
it's shockingly common, and you should, in my opinion, push as hard as possible to not let that be the case. You want to
Yeah.
meet the seller because kind of what you were saying is there's the qualitative side of it. Like here are all the procedures they're doing, and you
Hmm.
can look at the numbers and go, okay, yep, I can do that. I can do that. You're checking the boxes, but
Right.
it's the conversation with the seller behind why do you do it that way. That's the qualitative side of it that is going to be,
Yeah.
if not as important, then close to it, right?
Because also, like, a seller could bill out just a lot of crowns, but that might be for full mouth rehab.
Mm,
So maybe they've had training in something called spear, panky, cois. These are high level CE classes that not every dentist, we're not trained in dental school to do this. So you don't know also from a report, but if you had a phone call conversation with this seller, even, and you can't meet them in person, hey, like, tell me a little bit about your background, your career journey, like what has been your favorite CE classes? What have you seen the most return on investment? These are the things that I help prep the buyer with. And sure enough, we find out more. And we've had some buyers pass with the practice because of cois and spear and all these types of trainings. And that's just not to the level that our buyer wants to be at. And that's
mhm.
okay. We don't all have to be the comprehensive type of dentist either.
And
So,
we go back to one of the first things you said, 80%, right? You're not, when we're talking about clinical overlap, you're not looking for the practice that is already doing exactly what you plan to be doing in the future. You're looking for a good Venn diagram, right? Where yes, there's going to be gaps, there's going to be opportunities for growth. Um, so when we're talking about overlap, keep that in mind. It's not You're not looking for 100%. All right. We'll shift gears just a little bit for the last couple of questions. We've got a couple of questions that I think are going to be great for a general Q&A, but maybe we can address them here for just a few moments as well. Valentina pops in and says, I believe many employees are significantly overpaid, increasing the overhead. How to approach that? Oh boy, yeah, good question.
Loaded question.
Yeah, what? How would you? Yeah, how would you answer Valentina in 60
Well,
seconds or less?
yeah, again, this is where it depends. So, are these employees also skilled in something very specialized for this practice? And so, if that's the case, you're gonna have to pay a little bit more. But are you looking at, you look at temp agencies around your area and see kind of like what's the going rate for an assistant in that area, hygienist, etc. Do they kind of fall in that, pay scale? And if they don't, then it's a hard decision, but at the beginning, we really do not encourage to make any changes because, again, part of the practice sale is not only patient goodwill, but staff goodwill. And you need to learn their systems, you need to learn what's going on in that practice. And, we'll help you figure out a future plan with our cash flow analysis and doing a report, and we can talk further and get more information, but it's hard without knowing specifics. So.
Yeah, fair enough.
And
Um,
and just try to increase revenue. If
that
you
I was just gonna say, yeah, how, so if you think that employees are often being overpaid, maybe, you look at a practice and it's, yeah, if 45% of your annual collections are going toward paying your staff, yeah, that's a lot of money going to them. Okay, so fair enough. But the best way out of that situation is not going to be to come in and fire somebody right away just to free up cash flow. Like you're gonna just murder the morale in your practice if you do that.
yeah.
And so you've got a couple of options. The first one would be to establish yourself for, I'd say, minimum 6 months without making staff changes, probably more like 12 to 18, and if possible. And then maybe look at adjusting, which positions are filled by whom, okay, maybe. Again, you're not going to endear yourself to the rest of the staff when you let that one person go, but possibly it's justified at that point. Don't do it on day one.
Yeah.
But the better way, as you say, is to grow your way out of it. And so if you're doing let's say you're doing $1 million in collections and 450K of that is going to staff, well, try to grow yourself up to 1.5 in collections and without adding any new staff. Um, do some new procedures, be that CE junkie, and start pulling in some other things and grow your way out of it. So it's a good question. It's a good concern.
Mm-hmm.
Um,
Valid.
but really, it comes down to finding the right practice. And oh man, we need to do a whole webinar on finding the right practice. So I'll just say, go back. In fact, I'll go to the that last slide. Go to that find a practice QR code, get the PDF, and learn about the 80/20 rule and why we talk about it. And that'll help you a lot with that specific question. Stepping into the right practice is good. So, okay, all right. We saw this one already, but Steph Curry asks us, overhead is a concern I have too. We talked about the seller staying on. Is that negotiated in the purchase? What does it look like financially? Maybe we can just talk briefly about, is that negotiated in the purchase and when? What have you seen most typically, Sapna?
So when a seller is going to stay on past a year, we do, funnel it into our cash flow analysis. So therefore it does become part of the overhead because now a seller is considered an associate.
Yep.
So whenever there's an associate on a practice, it can be a good and a bad. Most times practices are losing money on an associate, but in this case with clinical philosophy overlap and maybe there being a need for it, it can make sense financially and both like qualitatively, right? So that is something that is somewhat negotiated in the price, but it's not a huge factor because at the end of the day too, we want you to get the loan, and sometimes in order to get the loan, you got to keep the seller on. So it's case by case, practice by practice, but historical data is really meaning historical financials is what we really look at in a purchase price.
Yeah. The bank is really important in this case as well. You kind of mentioned them, but in my experience in conversations that buyers have with bankers, if there is a gap in the clinical overlap, if it's pretty significant, hey, 30% of their revenue comes from molar revenue or molar endo. And yeah, I do a little bit of that, but I need to get trained up. The bank might say, okay, yeah, that's a big gap. Is the seller staying on? Are they going to be there for 6 months to train you up in that? And so the bank is looking at that in a long-term way, where, as you say, you got to pay that now associate, right? You got to pay the seller for a while, and you might be losing money for a little while on that part of the deal. But the bank knows that, hey, this is a long-term play. This is a
Right.
10, a 15-year loan. And so even if you're losing money a little bit for that first 6 to 12 months, the investment is now you're going to be able to do those procedures. You're getting that overlap, a little overlappier.
Yeah.
I'm coining it. So, right, fair. The banks are going to be a good gatekeeper there again.
Yep.
Right?
Yep.
So there we go. Anyway, let's go ahead and wrap it up there, Sapna. Thanks so much for joining me. And thanks to everybody who's been hanging out in the audience and in the chat. So if you are watching this later, then make sure that you go to our website or just shoot me an email at the bottom of the screen here. And I'll make sure that you are on the list for the next live webinar that we do. If you're watching live, thanks so much for the questions and the participation. And don't forget, watch your email inbox. We're going to be notifying you when there's another webinar coming up, and it'll be pretty soon, probably just a couple weeks out. And we'll do a general Q&A. That's the plan that I have for the next one. So watch for your opportunity to throw your question in the mix, and we'll pull it out of the hat and answer all sorts of stuff. So that'll be coming up very soon. Thanks everybody for watching. Thanks Sapna for joining, and I'll see everybody next time.
Sounds good.